When at hospitals, hospitals can be a scary place for the patients that are staying there, but it can also be scary for the workers and the unexplained events that seem to occur in a hospital all the time. In my 10 months of being a nurse, I have experienced a few unexplained occurrences, and I thought it'd be interesting just to share what I've seen so far, or have not seen. The first occurred when I was just a nurse for a few months, so I was still getting the feel of things. I was standing in the hallway with my coworker, and we were in eye's view of our break room across the hallway. And in our break room, it used to be a patient's room. So in that break room, we have a bathroom that used to be a patient's bathroom. In our hospital, all of our patients' rooms have bathrooms in them. If you've ever been in a bathroom in a hospital, in a patient room, they have something that you can pull on when you're done in the bathroom or need assistance. So if you pull the alarm, it alerts the staff that you're done or need assistance, and it alarms on our phones, and it also alarms on the outside of the bathroom so that you know what room it's coming from. Me and my coworker are just standing in the hallway, doing our charting, talking, and then all of a sudden we get an alert on our phones that somebody needs assistance in a bathroom. So we see the alarm going off in the break room. So we're like, oh, okay, like maybe it was just like an accident. We go and check it out. We, just kind of stand there for a second, like, what do we do? This alarm's going off. You give a little like, knock, knock, are you okay in there? And we don't get an answer. So now we're like, oh no, maybe one of our coworkers really needs help. Like maybe they passed out on the toilet or something. We eventually decide, yeah, we should open the door. So we do, and instead of finding our coworker like passed out or something, we find nothing, which is even worse. I'd rather have seen a person. Now these alarms don't really just go off on their own. You really have to give it like a tug to alarm it. So we saw that it was pulled out. We just stand there in silence in this bathroom looking at each other like, you see that too, right? We knew that there was nobody else in the bathroom or in the break room for at least 10 minutes because we were standing in the hallway for a decent amount of time and we didn't see anybody enter the break room or leave the break room. So it couldn't have been pulled and then somebody left. We didn't really say anything else. There wasn't an explanation for what happened. We just put the alarm back, left the bathroom, left the break room, and kind of just stood in the hallway looking at each other like, that just happened. Still don't have an explanation for it. We still talk about it to this day. Tell our other coworkers about it, and they're like, yeah, well, that was a patient room for many, many years, so maybe it was a patient trying to use a bathroom. We will never know. Next story is something that seems to just happen continuously, and everyone on my unit just kind of accepts it. There's one specific room that seems to have unexplained occurrences all the time. Since the time that I've been working there, everyone just kind of accepts this room as like the cursed room. And I guess we're just living with the ghost that still wants to be in that room. For example, something that happens a lot when I seem to be in the room is our rooms are decently big. So like when you first enter our patient's room, you get a bathroom. Each patient room has their own bathroom and a sink, and it's right by the door. And then you have to walk through the room to actually get to the patient's beds. So I walk through the room, taking care of my patient. I can be there for a couple of minutes, and then every so often, the paper towel dispenser, which is automatic, like you gotta wave your hand in front of it, will go off. And the patients see it happening too. We're both at the other end of the room. They know that nobody's on that side of the room. It goes off and we kind of just look at each other like, yeah, the paper towel dispenser just dispensed the towel, it's fine. So then, I feel bad for the patient because they're the ones that are there by themselves, especially at night, but I can leave. But that's something that seems to occur pretty often. Another thing that you can sometimes expect when you're in the room is when you're trying to enter the room. We usually leave our patients' doors closed because a lot of our patients are on isolation, so the doors are always closed. Sometimes when you try to open this door to this specific room, you are met with resistance. You have to like shoulder it in to get in sometimes. And it's not like it's a faulty door or like a malfunction, because it's not all the time. It literally is just sometimes when you enter the room that you really have to give it hell to get it. It's very scary when you have to like, you're met with resistance, like somebody else is on the other side of the door holding it. That's what it feels like. And I'm not the only one that has that issue. I've seen other coworkers try to get in the room. Now, some of my coworkers have also said that they have heard voices in the room when there's no patients in that assigned room. That hasn't happened to me, but they all swear by it, mainly night shift. The night shift nurses seem to report that there is talking going on in that room at night. So, I don't know, maybe that's the meeting room where all the little souls go and, I don't know, have a tea party. I'm not a ghost. I don't really get good vibes from the room though, like, it's just a creepy vibe. Maybe because I just know what's been going on in that room for so long, and I just try to stay clear of that room if I don't have a patient in there. But, you know, that's just the haunted room on our floor, and we've all just learned to accept whatever's in there. Now, I have one more story that just happened last month, so this one is still recent in my mind. I was doing 2 shifts in a row, so like I was working like a Monday and Tuesday. On my first shift, I had a patient pass away in my specific room that I was caring for, and the next day that I came back, I had a new patient admitted to that room. And I was standing in the hallway in front of the room, just doing some charting, and then my manager came and just was talking to me. We were standing in the hallway, so I was standing in front of the room, the door was closed, and then so she was looking onto the room. And we were just talking, and all of a sudden I see her kind of like jump back a little bit, and like she's looking like around me to see what's going on behind me, and I'm like, what? Like, what's happening? And she's like, does your patient have a visitor? And I was like, no, he doesn't have any visitors. And she's like, I swore I just saw somebody by the sink and like he just disappeared. And it's not like my patient would have been getting up to go to the bathroom, because he was bedbound and it would have been impossible for him to get up and go to the bathroom. So I'm like, oh, that's great. I'm like, I actually just had a patient in here yesterday that passed away. And she's like, oh, all right. I'm just gonna pretend you never said that and we're not gonna talk about this again. And I went, all right, sounds good. So those are some stories that I have had in my less than a year of working as a nurse. So I wanna hear if you guys have any haunted stories of working in a hospital, or maybe being a patient and you had something weird or unexplained happen to you. So give a comment and let me know. And also give this video a thumbs up if you like it, and maybe you want to hear some more stories that wind up happening to me. But thanks for watching.